Pleased to invite Lauren, welcome today, who's from the Women and Equalities Research Lead from Anglia and Ruskin University. So I'm sure we're in for a really exciting presentation this afternoon. So welcome, Lauren, and I'll let you introduce yourself and your presentation.
Thanks, Kate. I hope you can all see my screen and hear me. Unless anyone says otherwise, I will assume you can. So I'm Dr. Lauren Godier McBard. I'm a Senior Research Fellow at the Veterans and Families Institute for Military Social Research, and we are a research institute that runs out of Anglia Ruskin University. My role within the institute, in part, is to run our Women and Equalities research stream. And I'm particularly interested in the impact of military service on health and well-being after service for women. So I'm going to present the findings of a project that we launched in June this year. We also served, which was focused on pulling together everything that we know about the health and well-being of female veterans in the UK. So why did we carry out this project? Well, research with female veterans in the UK and internationally is limited, with the exception really of the United States, who have developed quite a large body of research at this point. But one paper recently reported that just 2% of veteran research internationally mentions women, and even less than that focuses on women and their experiences in the military. And this means that our understanding of women after service and their needs is limited. So in recognition of this, the Confederation of Service Charities Female Veteran Cluster Group, supported by NHS England and NHS Improvement, commissioned us at the Veterans and Families Institute to look at the evidence base related to female veterans in the UK. And the aim of that was really to outline what is and isn't known about their health and well-being according to the research landscape, and importantly to then provide a prioritised framework of how we then take forward research and support and policy activities with women going forward in the UK in a meaningful way. And this was the first time that the research in this area had been brought together and published in the UK in one place. So what did we do? Well, there were three elements to the evidence gathering phase of the research, I guess you might call it, which is in blue at the top here. The first was a comprehensive literature review, and this involved us systematically searching through academic and grey literature databases for both academic papers and other research reports and things like that that outlined any kind of primary research with women veterans in the UK. And now to support the limited UK evidence base that we expected we would find, we also collected international literature, primarily from the other Five Eyes Alliance countries, particularly because of the alignment in culture of those countries, to look at the consistency in findings and gaps in the research base in the UK, rather than necessarily to apply these to a UK context. Additionally, we use statistics and reports that have been provided and published by the Ministry of Defence in order to provide context where it was relevant. To supplement this literature base, we also interviewed 13 subject matter experts, and these were all individuals who had experience of working with or supporting women veterans in some capacity, with representation across statutory and third sector support services and organisations. And these interviews focused on their perspectives of the impact of military service on women and also women's experiences following transition. In addition to that, we also disseminated a call for evidence through our networks, and this was just to make sure that there weren't any previous or ongoing research projects that we'd missed. And the evidence from these three elements was then combined, and we carried out some stakeholder workshops with women veterans and also representatives from veteran support organisations. And the purpose of these workshops was to discuss and identify priority areas for research and support and policy from the perspectives of these stakeholder groups. And we did this with a number of interactive activities, including breakout discussion groups, really trying to get the perspectives of the people that would be involved in our kind of recommendations recommendations going forward. And then we focused on how we would amalgamate and rank those priorities to give us a useful and meaningful framework for taking things forward. So now to the meaty bit, I guess. What did we find? Well, we found 50 research papers, and this included academic papers, research reports from different organisations, and also we included PhD theses. And these were all published between 2000 and 2020. That wasn't because we limited our search, that was just what we found. There wasn't anything before that. And the majority of these have been published in the last decade or in the last couple of years. The large majority of research in the UK is focused on the physical and mental health of women veterans, and is dominated by two large cohort studies that you might be familiar with, one being the King's Centre for Military Health Research and the other being the Scottish Veterans Health Study, both of which have surveyed large numbers of both serving and ex-serving personnel, men and women. But interestingly, there was a really stark contrast between this focus of the research on health and the issues that were highlighted in our project by our subject matter experts and our stakeholders. And these discussions heavily focused on the challenges associated with how women were treated in service, particularly associated with what people describe as the male-dominated or masculine military culture, and also as a result of historic discriminatory terms of service that women that meant that a number of women were terminated early. So these were things like being discharged for pregnancy, marriage, or the ban on homosexuality, which obviously impacted men and women, as well as the socio-economic impact of all of this on women post-service and how they impact women's access to support after military service. So these were all things that were discussed by our stakeholders and SMEs, but weren't really very evident in the literature, at least not to a massive extent. So I'm going to walk you through our main findings, looking first at in-service experiences and issues that women report experiencing, and then how their health and well-being is impacted after service. And I would stress that it's really beyond the scope of my presentation today to go into detail because there was a lot of findings. So I would recommend downloading the report to look in depth at the findings, and I can put the link in the chat later for anyone that's interested. So going into the findings, the evidence focused on in-service experiences was limited, although it was broad in terms of its findings, and you'll see what I mean by that. But it was centred around a few qualitative studies, really. And one of the in-service issues that emerged was the experiences that women reported in joining the military environment. And there were a number of themes that we identified from that qualitative research related to that. So women reported the importance they felt of masculine banter in fitting into the military, and others reported adopting what they perceived to be male or masculine traits. And women across studies also reported feeling as though they had to work twice as hard as their male colleagues to prove themselves, and feeling as though they were evaluated differently just by nature of their gender. Women also reported experiencing stereotyping and discrimination related to their gender in these studies, which was sometimes minimised again as banter, but many women in these studies felt that they were treated unfairly on this basis and didn't feel able to challenge these attitudes during their service. Some women also reported distancing themselves from other women or avoiding feminine traits to avoid what they perceived as discrimination associated with that. And with the female gender in general. So our subject matter experts also discussed these difficulties and felt that there was quite a high tolerance for negative gender stereotyping and discrimination within the military culture. However, what we don't have at the moment in the UK is any substantial, I guess, research that looks at the link between these services to health and well-being outcomes during or after service. So we found a small amount of research related to deployment and unit cohesion and the outcomes associated with these for women, which suggested that there were little differences really in health outcomes related to exposure to combat and deployment between men and women. However, we did find from a few, again, small qualitative studies, that women don't always feel like their deployment roles are recognised by society more broadly, or that they may be dealing with the same types of trauma as their male colleagues, despite the fact that, of course, women have been serving in frontline support roles for many years. Women in these studies were also less likely to report high levels of unit cohesion compared to men, and highlighted a perceived lack of social support from their unit, but particularly in the cases where they were, for example, accommodated separately to men, so they were spending less time with their male colleagues. Additionally, some qualitative research highlights that some service personnel were resistant to women being in leadership positions, and the women themselves felt that they were reluctant, or other service personnel may be reluctant to work with them while they were in those positions. And international research actually highlights the fact that some women feel the need to adapt their leadership style to that of their male colleagues, and felt that, again, that they were evaluated more harshly in that role. However, we weren't able to identify any research in the UK specifically that looked at women's experiences of leadership during their military service. Work-life balance for women was the area of focus in terms of in-service experiences that had the most research evidence in the UK. And this research suggests that, perhaps unsurprisingly, balancing military life with having a family is difficult. And in terms of women specifically, it appears to be related to increased physical and mental strain. And this was seen as particularly challenging as well for dual serving couples, so families in which both parents are serving, as juggling those work commitments is particularly challenging in the military anyway, with deployments and unpredictable working hours. So this adds another layer of complexity to that. A large survey studies suggest that women are actually more likely to leave the armed forces early than men, and that's quite a consistent finding. And the most common reason cited for this is due to pregnancy, having children, or other family related reasons. And this is supported again by qualitative work in the UK, which suggests that becoming a parent significantly alters women's career trajectory, even for those who initially planned on staying in the armed forces after maternity. Most were likely to leave at some point and give that as a reason. And I guess what is kind of stark here is that the fact that the restrictions on things like pregnancy were lifted 30 years ago now, but women are still leaving most commonly as a result of having children or for family reasons, and again supporting the findings associated with this difficulty in managing a military career with family life. So sexual harassment and assault is something that's picked up a lot in the media in terms of the military, and was as well a large focus of the recent Defence Select Committee inquiry into women in the armed forces. But what we were looking for here is what we actually know from the evidence base. And what we found were just a couple of reports focused on this in the UK, supplemented by reports and surveys from the Ministry of Defence itself. And indeed, when we look at these reports and surveys from the Ministry of Defence, and these span from all the way back to 2006 to a couple of years ago, and these suggest that a sexualised culture remains a problem in the UK Armed Forces, and we're seeing that consistently in reports that are coming out over and over again. Women are more likely to report all forms of harassment and targeted behaviour compared to men, with up to 70% across these reports reporting some form of targeted sexual behaviour, from unwelcome comments to the more extreme kind of sexual assaults, over when they're asked, has that happened to you over the past 12 months? And so whilst these surveys give us an idea of prevalence in the past year, what we found was a lack of research looking at the prevalence over the course of the military career. So asking women veterans, have these things happened to you? We did find, again, a couple of reports that looked at this, one suggesting that 50% of women interviewed had reported being sexually assaulted during their military service. And the recent Defence Select Committee report found that 62% of women that they spoke to had reported some type of bullying or harassment, including sexual offences. However, what's clear is that we need more research in this area to confirm these findings to get a better idea of the problem. In every report that's available, though, women and also men talk about a reluctance to report these experiences and a lack of trust in the military complaint system. And this is sometimes also related to a fear of the repercussions that they might experience in terms of their career and their work environment if they do report. Our subject matter experts highlighted the impact on mental health and help seeking, but we found very little to no research in the evidence research in the UK to illustrate this. As is the case with most veteran research, there is a significant body of evidence now in the United States that links what they term military sexual trauma to poor mental health outcomes and significant difficulties adjusting to civilian life. So to summarise our in-service findings, the limited research that we have in the UK highlights a number of what we would term gender-related experiences here, including discrimination, harassment and violence at the more extreme end that have the potential to significantly impact women's health and well-being. But we are lacking in this area, and a lot more needs to be done to help us to better understand this and what it means for women after service. So this brings me on to what we know about the health and well-being outcomes of women after their military service. And this is where the majority of work with women veterans has been carried out in the UK. Research looking at the physical health of women, which either compares female veterans to male veterans or to female civilians, which I've donated here on screen as FC or MV. Again, was dominated by these two large survey cohorts from King's College and the Scottish Veterans Health Cohort. Differences between male and female veterans were mostly in line with civilian gender differences that we find in health conditions anyway. And I've highlighted a few differences on screen here, but again, there's much more detail on this in the report if you're interested. When looking at women who've had military experience compared to civilians, there were certain types of cancers, in particular ovarian and breast cancer, that were more common in certain cohorts in the Scottish female veterans cohort compared to civilian women, as well as increased levels of hazardous drinking. And whilst not identified directly in the literature, the subject matter experts and stakeholders that we spoke to highlighted problems with musculoskeletal issues in female veterans, which is also reported by the Ministry of Defence in one of their reports, which finds that women are more likely to report musculoskeletal conditions as a result of training compared to men. So again, that's something that needs to be investigated a little bit more, because we just don't know very much about it. When it comes to mental health, most evidence in the UK suggests, again, few differences to male veterans, with the exception of some evidence of increased self-reported common mental health symptoms compared to men. However, these findings are slightly inconsistent across studies. However, there is evidence that women are at lower risk of suicide, suicidal ideation and self-harm compared to male veterans. But when it comes to a comparison to female civilians, there are some differences of note. Female veterans are 2.5 times more likely to report probable PTSD and appear to be, again, 2.5 times at a greater risk of suicidal ideation and suicide compared to civilian women. Additionally, one study found an increased likelihood of suicide or suicidal ideation in women who had joined the armed forces prior to 1991. So I haven't included this on screen here, but again, if you want more detail of that, you can have a look in the report. And this was an interesting finding, although again needs to be looked at more, because it suggests that women who served in historic service eras, particularly as part of the women's cause or prior to the lifting of the policies related to pregnancy and homosexuality, may be more at risk of suicide in this sample more broadly. So for both physical and mental health outcomes in female veterans, there is a significant lack of qualitative research, and that was really clear. So there's not a lot of research that's looking more in depth at why there may or may not be differences in health outcomes, and none of the research looks at the links between health outcomes and those kind of experiences in service that I was talking about earlier. Similarly, as you'll see throughout the presentation, there's a lack of research looking at women's employment and financial security in the civilian world. However, female veterans do appear to be more likely to be unemployed compared to male veterans. But what's unclear from the evidence in terms of this is how many women are not employed but are not looking for work. So what we would term economically inactive, and how this might relate to things like caregiving responsibilities. So at the moment, the data that we have isn't really clear on that. There are some qualitative studies that provide evidence of underemployment in female veterans, and what I mean by this is in relation to them not being able to get the job that perhaps they might like. The majority of women who were unemployed in these studies wanted to be as well. And women also report difficulty selling themselves to employers and recognising their transferable skills, which is also reported in male veterans. Finally, in terms of this topic, it was felt by subject matter experts that improvements could be made to the employment support and resettlement to better suit women. And this was supported by qualitative research as well, which suggested that the support that's available isn't necessarily targeted well to meet women's needs, and perhaps is perceived as supporting more stereotypically male occupations. So a clear theme that emerged from our findings was related to women's identity after leaving service and how this might be linked to their help seeking or access of support services. In terms of identity, female veterans report that they are less likely to identify as veterans compared to their male counterparts. And qualitative research suggests that female veterans perceive this label to be associated more with those who have been in combat or older males. And the studies that are available suggest a preference for the use of ex-service or ex-military than veteran. However, this isn't to say that women don't feel pride in their service at all, but there is emerging evidence that perhaps they don't feel as though this is as well recognised in society compared to male veterans, and that's impacting how they identify themselves. So it appears that there is again quite a lot of work to be done here in terms of how women identify and how that might relate to their well-being and support needs and preferences. So in terms of seeking help, evidence suggests that women are more likely to access formal medical support compared to men, and this mirrors findings in the general population. However, there is emerging evidence that in addition to this, and in addition to being less likely to identify as veterans, women may experience gender-specific barriers in engaging with services that are directed towards veterans, so veteran-specific services. And as I said, there is suggestion that this may be in part to do with the fact that they don't identify themselves as a veteran, they don't know that they're eligible, they don't know that those services exist, but there is also evidence that things that they've experienced during service, such as the negative gender stereotyping that I talked about earlier, a perception of female weakness, but also a lack of awareness of those issues in civilian healthcare professionals, is all impacting on women perhaps not being or not wanting to access those services. And this was supported by our subject matter experts who felt that there was a lack of engagement from women with veteran support services, and that this was due to both a reluctance to attend male-dominated services and events, but also a lack of awareness of these services. So more research again is needed to look at this, and this was something that our stakeholders focused on heavily in our workshop as well and felt should be a priority, which I will go into in a bit more detail in a minute. So that was a really quick tour through our main findings, but I do just want to quickly highlight what the main gaps and limitations are of the UK evidence. As I mentioned, the evidence base is very broad. There's a lot of topics looked at, but nothing is looked at particularly in depth at this point. And there is a lack of research in these kind of issues that are here on screen. So looking at experiences during service and how these have impacted on health and well-being after service, and also the more kind of socio-economic issues that women might experience, rather than just looking at their kind of health related issues. So in terms of our recommendations, we split these into those related to support and policy and those related to further research. And these were developed with our stakeholders during a number of activities that resulted in us working with them to rank the importance of those, and then amalgamating those ranks between different groups of people. And I won't go into detail about that, but again, if you want to have a look at how we did that, there's more details in the report. But in regards to support, the top priority was around ensuring that that veteran support services are targeted and tailored towards women. And this is following all the evidence that I've talked about, that women aren't necessarily engaging with these services and may not feel that they meet their needs or that they are eligible for them. In terms of research, our stakeholders felt that it was important that research focuses on the impact of sexual harassment and assault in service, that this hadn't had enough investigation at all at this point. And this was closely followed by examining how the masculine military culture more generally impacts on women. And there are a number of other recommendations for research evidencing the lack of in-depth research in many areas that I've talked about. So again, I would suggest having a look at that in more detail in the report if you're interested. And these recommendations are currently being looked at by both the COBSDO Female Veteran Cluster Group and a steering group that's been set up in the NHS to focus on the needs of serving and ex-service women, and we're also looking at these ourselves within the VFI and how we can take forward some of these research recommendations. So finally, I just want to highlight some work that I'm about to start following on from this, and this is particularly looking at that recommendation that veteran support services need to look at their offer for women and examine whether these are meeting women's needs. So we've just been successful in securing funding from the National Institute for Health Research, and this is for a project working with our local TILS service, our Veterans Mental Health Service in Colchester, and also salute her and Paula Edwards, who you are hearing from later, I believe, to carry out a project examining women's experiences of veteran mental health services. And the main aim of this project is to co-produce guidance and recommendations with those women for healthcare professionals who work with veterans, with the idea that this will help to make sure that they are meeting women's needs. And this project starts in a couple of months, so watch this space really for updates and opportunities to get involved in that as well. So thanks for listening, and thanks to everyone involved in the research that I've included on screen here. I've added my contact details as well in case anyone has any questions, and I'll try and drop the report link into the chat. Thank you.